So, Martin, shifting care isn't easy. And when you try to do this at HSE, which is the NHS of Ireland, for those of us who don't know, what hurdles did you face, and how did you bring staff along that journey with you?
Well, first let me say I didn't bring everybody with me, and and in fact, at some points experienced really extreme resistance, but a lot of people were on the journey with me. And one of the key principles of Open Innovation 2.0, first you have to have a shared vision, so a vision of a better future world. So sharing this vision that was better for patients, better for clinicians, was important. But another key practice is designing for adoption. So clinical environments are task saturated, really busy, always under-resourced. So and we can talk about what we call absorptive capacity. And one of the key issues is the absorptive capacity of stress medical systems is going to zero. But when you can design for adoption, when you can present a solution that is clearly 10 times better, 10 times easier, 10 times faster, then it gets adoption. So, the primary strategy was painting a vision of a better health system and then actually demonstrate. I'm a great believer in the value seeing is believing. So presenting a solution. And I'll give a real example. I work with amazing advanced nurse practitioner Antoinette Doherty in Donegal and the respiratory consultant Professor Vera Keatings. And we've been talking about this idea we could potentially monitor a real-time respiration rate of patients with severe COPD in their home. But they weren't quite getting it, and then we actually went to Donegal and we demonstrated it. And immediately, Professor Keatings and Antoinette said, oh my God, this can change everything. And they took that technology and they took 10 patients with severe COPD that were routinely hospitalized every month, terrible quality of life, stress system, a lot of costs. And they ran a 6-month living lab. And what they would do is they would, in the morning, the patients would wear this respiration device on their diaphragm, which you wouldn't notice, and they could see in the morning what had happened to their respiration rate, and if there was an exacerbation, they could intervene with a rescue script. In 6 months, there wasn't a single admission, and the patient testimonials were the strongest. We don't want to be in hospital, and this is changing our lives, and we're feeling free. So that's a brilliant example. So I think seeing is believing. And showing these solutions that are so obviously better. And what I witness here as well with Heidi, you're using sort of AI annotation tools and the cognitive load and doctor, there's a lot going on. And if you can capture in real time faithfully what's going on, it's saving time. I talked to one of your trainees this morning, he said it's saving 50% of his time.
And you're absolutely right, seeing is believing. When you show that to other people in the NHS, rather than telling them about it, you actually show them the difference it's making. They also want to adopt, so you're absolutely right.
Yeah, but probably the best compliment I ever got in the HSE was from a senior surgeon in a remote area, and he'd spent a lot of time in Australia, and he could see there was a lot of stress, and he sent me a note. He said, Martin, you're really rattling the system, keep going. And that gave me a shot in the arm. I'm going to keep going. So you won't bring everybody with you, but we're approaching this phase transition. And Machiavelli said, there's nothing more difficult to undertake, more perilous to conduct, more uncertain in its success to undertake to, take charge of create a new order of things. So what we are doing is a genuine, revolution. We're trying to turn health on its head and create a whole new theory of the business. And it's entirely possible, but actually it's brilliant to come to Winslow Health Centre and actually see that in action on a day-to-day basis.
Yeah, in a safe way. We're doing it.
Yeah, in a very safe way.
Yeah, despite everything else.
Yeah.